most important topic, the clinical correlation of the clinical and microscopic features of the gingiva. So let's start it. Bismillahirrahmanirrahim. So the first feature we will study color. Color is very important. It basically defines or it tells you about so many things. If the color is dark red, light pink, coral pink, so of the gingiva, it is actually also related, the changes in color is also related with so many diseases like anemia, like diabetes mellitus, for systematic diseases in systematic condition. Okay, now color of the attached gingiva or marginal gingiva is generally coral pink. Always remember, the gingiva is coral pink and it is basically depends on the vascular supply, okay, the thickness and the degree of keratinization of epithelium, okay, and then presence of pigment containing cells. So basically the color depends on the vascular supply, the thickness and degree of keratinization of epithelium, and the presence of pigment containing cells. It also varies among different type of individuals and appear to be correlated with the cutaneous pigmentation. Cutaneous pigmentation basically means that the color of the skin is basically depend on the amount or type of melanin that is released. Melanin basically a pigment which is released by the melanocyte cells. It basically control the color of the skin, okay. It is actually lighter in blonde individuals with fair complexions than in swarthy dark-haired individuals. Attached gingiva actually is demarcated from the adjacent alveolar mucosa on the buccal aspect by a mucogingival lining. Okay, so you can differentiate between the attached gingiva and alveolar mucosa by the demarcation mucogingival line. Okay, the alveolar mucosa actually is red, smooth and shiny rather than pink and stippled. There is no stippling on the alveolar mucosa. The comparison between the microscopic structure of attached gingiva with that of alveolar mucosa provides an explanation difference in appearance. That's why they both are different. Now the epithelium of alveolar mucosa is thinner, okay, non-keratinized, and it contains no ratty peaks. The connective tissue of alveolar mucosa is loosely arranged. The blood vessels are more numerous. Okay, then psychologic physiologic pigmentation. Melanin is a non-hemoglobin derived brown pigment. Okay, now what are the characteristic features of melanin? Basically is responsible for the normal pigmentation of the skin, means it is responsible for the skin, gingiva, for the remainder of oral mucosal membrane. It also present in all the individuals but of different quantities, and it is actually severely absent or diminished in the albinos. Okay, then basically melanin pigmentation in the oral cavity is more prominent in black people, ascorbic acid basically regulate the melanin pigmentation in gingiva. Okay, then they have told you about the distribution of oral pigmentations in black, that melanin is how much melanin is present in the gingiva, hard palate, mucous membrane, tongue, etc. Then gingival pigmentation is basically, of course, a diffuse deep purplish discoloration or irregularly shaped brown and light brown patches. Sometimes what happens in the gingival pigmentation sometimes has a deep purplish discoloration or irregularly they are brown or lightly brown. It is because the gingiva may appear early as 3 months after the birth. Means the child gingiva is basically purplish, means and it is often the only evidence of pigmentation, means the blood supply circulation has not developed till date. So the child the neonate has basically a deep purplish discoloration, okay, yeah, light brown patches. Now oral repigmentation also refers to the clinical appearance of melanin after a period of clinical depigmentation of oral mucosa. Means they are saying that the oral repigmentation is basically the clinical reappearance of melanin. Then when the melanin reappear after a period of the clinical depigmentation, means the patient has diminished, there is no pigment, and then and then it's again reappear. Okay, it is due to chemical, thermal, surgical or physiologic or idiopathic factors that gingiva become depigmented. Information about repigmentation of oral tissues after the surgical procedures is extremely limited, and no definitive treatment is often at that time, because means they are saying during the surgery it has extremely limited, and there is actually no treatment at that time you will give to the patient. Okay.